In this video, the clinical user will learn how to document a missed visit progress note. The purpose of a missed visit progress note is to remain compliant with the plan of care for the patient. The clinician is responsible for delivering the services according to the plan of care written for the patient. If services delivered deviate from the plan of care, then documentation is necessary to justify the deviation. For instance, if a plan of care indicates that a patient will receive therapy 2 times per week for 30 minutes, and only 1 time is provided in the given week due to illness, inclement weather, or vacation, then a missed visit progress note is written to document why services were not in compliance with the plan of care. Let's take a closer look. Missed visit progress notes may not be documented prior to the appointment day and time. For example, a user cannot document a full week of missed visit progress notes if they know that they'll be on vacation the following week. Missed visit progress notes can only be documented after the appointment time has passed. It is a good rule of thumb to only document missed visit progress notes at the end of the week. A visit is only considered missed if the patient was not seen according to the frequency and duration listed on their plan of care. For example, if a patient's plan of care dictates that the patient will be seen once per week and the patient did not appear for their Monday appointment, the appointment would only be missed if the patient was not seen at all that week. If the patient that failed to appear for their Monday appointment was instead seen on Friday, there would be no need to document a missed visit progress note because the patient was in fact seen according to the frequency and duration indicated on the plan of care document. By waiting until the end of the week to document missed visit progress notes, the user can make every effort to reschedule the session later in the same week. To document a missed visit progress note, the clinical user will tap on the red appointment from the schedule. Remember, red means stop. The appointment is red because the appointment time has passed and the visit has not been documented. The action form will appear and the user will tap Document. The user will confirm the date of the missed visit and tap Continue. If the missed visit did not occur on this date, the user will need to exit from the progress note and reschedule the appointment in the correct date on the schedule. Next, the user will be asked to identify the place of service type. In this scenario, the patient did not have a service, and so the user will tap the Missed Visit button. The user will be asked to select who was responsible for the missed visit. Did the patient cancel the appointment due to illness, or did they no-show? Did the therapist cancel the appointment due to the fact that it's a holiday, sick day, or vacation? Other could be used for items such as funding changes or even bad weather. The user will then enter the details about the missed visit. Once the missed visit documentation is complete, the user may tap Continue. The user now has the opportunity to preview the missed visit progress note documentation. The user may then tap the Sign Progress Note button. The user will then be asked to attest and sign the document by means of tapping the Yes, Sign Progress Note button. The user will enter their unique password. Once the missed visit progress note is signed, ACE will alert the user that the document has been filed in the EMR. The user will also notice that the appointment color will change from red to yellow. A yellow appointment is a documented, unsynced appointment. This yellow coloring is simply cautioning the user that they need to sync their data. After a sync is performed, the appointment will change from yellow to purple. A purple appointment is a missed visit appointment. A user can access a missed visit report by going to the Reports section of ACE. Remember, the pattern of running a report is to go from left to right, top to bottom. Therefore, the user should begin by choosing the Missed Visits report. The user may enter a date range if they would like, but it is not necessary. Only the dates within the last 30 days are eligible. Finally, the user should tap the Run Report button. A list of missed visits will appear on the report, along with the current Medicaid authorization dates. The report will show which missed visits are available for makeup versus the visit that may have already been made up by the clinician. This report may prove useful if you find yourself with a sudden appointment vacancy or unexpected availability. This concludes the missed visit progress note instructions for ACE. For further information, feel free to watch the video again and pause as necessary. Additionally, you may consult the written clinical ACE manual for detailed instructions and screenshots related to specific features and tasks.